Good afternoon, folks. Today's topic C is a little bit of a twist on alternative care options for seniors and young people looking for care. Okay, so we're going to get into that. Title is Churches Are Getting Involved in Long-Term Care. Okay, so here we go. Churches can make a measurable long-term difference for young people leaving alternative care by offering stable relationships, practical supports like housing and job pathways, and and intentional partnerships with local agencies, new multinationals research involving 962 care experienced adults underscores how often these young people enter adulthood without the safety net most of their peers take for granted. Why this matters, the global picture. The study perceived support and barriers in transitioning to adulthood from alternative care. Child and Family Social Work, December 2025, surveyed adults from 20 countries, giving us one of the clearest cross-cultural snapshots of what happens after young people leave foster care, orphanages, or other non-parental settings. Across regions, the themes were strikingly consistent. Housing instability is common within the first 12 to 24 months after leaving care. Employment barriers persist due to limited networks, inconsistent schooling, and lack of adult guidance. Social isolation is profound. Many responds Many respondents reported having no long-term adult they could rely on. Mental health needs remaining high, especially for those who experience trauma. Abandonment or institutional living. These are not small gaps. They are structural vulnerabilities that follow young adults into every corner of life: finances, relationships, education, and emotional well-being. And that and this is where churches with their built-in community infrastructure can become stabilizing forces. What churches can uniquely offer? Faith communities are one of the few institutions that can provide long-term, non-transitional or transactional relationships. The very thing the research identifies as most protective. Sustained mentoring and relational community. A trained, consistent adult presence for 12 to 24 months can dramatically reduce loneliness, improve job stability, and increase confidence. Churches can create one-on-one mentoring programs, small peer groups for young adults, adopt a graduate teams who check in monthly. These relationships often matter more than any single service. Life skills and employment pathways. Many care experienced youth never had someone teach them the basics. Churches can fill that gap with budgeting and financial literacy workshops, resume and interview coaching, access to congregates who can offer internships, apprenticeships, or job leads, transportation assistance for work or school. These small interventions with outsized impact. 3. Transitional housing and emergency support. Even modest efforts can prevent homelessness. Short-term rental assistance, partnerships with local transitional housing programs, a vetted host home model with strong safeguard policies, emergency funds for food, transportation, and medical needs. Housing stability is often the difference between thriving and crisis. 4. Formal partnerships with child welfare agencies. Churches shouldn't operate in isolation. Coordinating with county agencies ensures proper safeguarding, clear referral pathways, avoidance of duplicated or inappropriate services, access to training and best practices. This is where impact becomes sustainable rather than headache. A 90-day starter plan for any congregation. This is a realistic, low-risk way to begin. Month 1, build the foundation. Assess volunteer capacity, budget, and available space. Identify a program coordinator, meet with local child welfare staff, and understand needs. Guys, these children that have issues, having housing issues and things, they become adults sooner or later down the line, and they also become senior citizens with needs. So that is why I chose this subject for today, because these folks turn into elderly folks in the long run that need the same supports. So, with that being said, let's finish the program here. Let's see. Begin trauma-informed and boundaries training for volunteers. Month 2, launch a pilot program. Start with one program. Example, monthly life skills workshop. Mentor matching for 4 to 6 young adults. Establish clear safeguards, policies. Create simple intake and referral forms. Month 3, evaluate and adjust. Track early indicators, attendance, engagement, housing stability. Gather feedback from participants and volunteers. Decide whether to expand, refine, or add a second support component. This approach keeps the program manageable while building credibility and trust. Risk, limits, and safeguards. Church involvement can be transformative, but only when done responsibly. Safeguarding is non-negotiable. Background checks, trauma-informed training, clear boundaries, especially around housing and finances, written policies for mentoring, communication, and crisis response. Volunteer burnout is real. Start small, document impact, seek grants or denominational support before scaling. Churches must avoid saviorism. The goal is partnership, not young adults should be co-designers of the support they receive. If you want to take this further, I can help you create one-page pilot program plan for small or mid-sized congregation. A leadership briefing summarizing the research and case for action. A checklist of questions to ask your county's children and youth office. A trauma-informed volunteer training outline. Okay. Then the next part of this is religious communities across the U.S. urgently rethinking how to care for the aging members, balancing spiritual identity, financial strain, and the need for specialized long-term care conversation. The conversation spans everything from de- uh, dedicated retirement funds to faith-based senior living models and the unique emotional needs of vowed elders who are here's a clear research grounded breakdown of what's happening and why it matters. Why this issue is rising now. Religious orders, Catholic, Protestant, Jewish, Buddhist, and others are facing a demographic shift. Okay, most people who are wanting alternative care options look for faith-based nursing homes to go into, folks. Now, these are nursing homes that are that are tied to churches. These facilities give the same kind of care as a county home, but they're faith based, meaning they're church based, ran. So their beliefs are a little bit different than the regular nursing home. So you have to keep that in mind also when you're looking for alternative care, or if you're going to go faith based, you have to make sure that the nursing home has strong ties to the church. Um, that makes sense if you're going to go faith based care. So that is why I did the show this afternoon or this evening for this one, is so that people understand there are alternatives to senior care options. So with that being said, for now, Gator Wellness, take care, folks. I'll jump back on later for another show, maybe. We will see what happens. For now, Gator Wellness, take care, folks.